On top of all the usual thanks, I'd want to thank Professor Maniatakis, if I pronounced your name right, great, for giving half my talk. I think it's absolutely right that there are different approaches being taken by different countries. That's a good thing in my view. We don't yet know what will work. And what we must do is we must carefully review the evidence as it emerges and then change our policies when we discover that they're not having the effects we intended or they're having unintended effects. I'd like to thank, of course, the organisers who invited me, but the invitation, I should warn you, came through Konstantinos Farsalinos. And Konstantinos has taught me three things. Always have too many slides, always talk too fast, and always overrun. So Konstantinos, this one's for you. For the translators and those of you who have trouble with my mongrel accent, concentrate on the titles of my slides. So seriously, translate the titles of my slides and worry less about the words that I say. It should all become fairly obvious. So here we go. Smoking rates in the UK are falling fast, but they're falling particularly fast over the last 4 or 5 years. So they've fallen almost 5 percentage points over the last 4 years. A comparable period with Australia for 3 of those years, because Australia only have published their data every 3 years, is 0. Yeah, that was my response as well. 0.5 percentage points for 3 years. So that's about a tenth of the rate of decline that we've seen in the UK in recent years. And our quits are more successful than ever. So more people are trying to quit, but also the quits are more successful, with about 1 in 5 quits being found to have been successful. It's pretty good. And in terms of the Framework Convention in Tobacco Control, Luke Houstons and Martin Raw have very helpfully produced a tobacco control scale, which essentially evaluates how well you comply with the Framework Convention on Tobacco Control. So it looks at all the things that the last speaker was looking at, and it weights them with. The UK generally comes top of that table. It's nice to come top of a table, and you'd wonder why we'd want to leave Europe when we're doing so well. But Greece, not quite so well, but I can see that there's been great progress made in recent years. Consequently, as you'd expect, if you're good at implementing the Framework Convention on Tobacco Control, it yields results. We know the FCTC works. And so you won't be surprised to see this slide again. I'm just highlighting that down there with Finland is the UK, and according to the Eurobarometer study, the second lowest smoking prevalence in Europe. I've got to say, these data sometimes disagree with national data, and contributing to this earlier argument, one of the problems with this is that the Eurobarometer survey has really quite small sample sizes nationally. A great way of comparing performance internationally, but not a great way of determining what the real smoking prevalence is. So they're about, we'd put the England smoking prevalence at 15.5%, not 17%. So some differences there. How did we get there? Well, through 2 decades of really hard work. We have had 20 years of comprehensive tobacco control in the UK. The latest tobacco control plan was published a little less than a year ago, and we've had some reference to this. You've seen this already. Thanks very much, Nicholas. So 3 ambitions to reduce smoking prevalence in adults, in pregnant women, and in youth, but also to reduce the inequality gap in smoking. We haven't yet worked out exactly how we're measuring that, but it's a very important issue. And as you've seen before, there's a big chunk of activity in tobacco harm reduction, and a lot of this responsibility is coming to Public Health England. So I'll just linger a bit on this one. We're going to monitor the impact of regulation, PHE. You've heard a little bit about our It was our third report, in fact, the one in 2015, but it got the most attention. And we've been told that we've to repeat that every year. Well, we've published the first of those 5 new reports, and we'll be publishing them annually for the next 4 years. Provide smokers with clear public information, evidence-based information about the relative harm of nicotine in e-cigarettes. And we'll also conduct an assessment of the risks of nicotine addiction, evidence-based guidance to health professionals to support them in advising smokers who want to use e-cigarettes, and a range of safe and effective products that can be potentially be made available for NHS on prescription. I have to say, these have to be licensed as medicines. We have no e-cigarettes currently licensed as medicines, though I hear rumours that one might be coming along the pipeline. Oh, that's not true. British American Tobacco sponsored the product. It got a license. They didn't introduce it onto the market. So we have no products available on the market for prescription, but I think these might come. But they will be medicines, licensed as medicines. Crucially, I think, reviewing the policy in relation to electronic nicotine delivery systems, because, as I've said before, and I will say again and again and again, none of us know what will work, okay? We're all, Stan Glantz tweeted me when we had the NICE harm reduction guidelines, and he said, England has entered the lab with tobacco harm reduction. And I said at the time, Stan, we're all in the lab, and it's incumbent upon us all to measure the results of our efforts with rigor and with candor. His reply was, you're wrong. Okay, so comprehensive regulation, as we've already heard, and much of this is part of the from the Tobacco Products Directive. We already had a minimum age of sale of 18. We have limits on concentrations, all this stuff that's already been addressed in the last excellent presentation. And also, of course, post-implementation review, which is going to happen within 5 years of the TPD at the European Union level, and if Brexit does work to schedule, then we'll probably do our own review a little bit earlier. How does the UK, or England in this case, fare against the WHO recommendations? We heard earlier what those recommendations were: prevent the initiation of among non-smokers and youth, and so we already have an age of sale, as I mentioned, and we have, the packs must state that products are not for use by non-smokers and children, but we've also banned advertising, which will be a very important feature, minimize health risks to e-cigarette users, and we have all the Tobacco Products Directive measures, prevent unproven health claims. We were already doing that. In fact, the first ads for e-cigarettes were all taken off the air because they made unwarranted claims. Only one TV campaign was not taken off the air, and that had the catch line, "Friends don't let friends smoke," which seems like a really good catchline to me. Anyway, so protect tobacco control activities from vested interests, and indeed this is a formal part of the tobacco control plan for England. Consider prohibiting and regulating electronic cigarettes as tobacco. Well, so again, this is done already under the Tobacco Products Directive. Consider banning and restricting advertising promotion. Well, I said we've already done that under the Tobacco Products Directive. Comprehensively monitor the use of e-cigarettes, including the relevant questions in all appropriate surveys. And without fear of contradiction, I think in England we have more national surveys than any other jurisdiction. We have 4 or 5 a year compared to Australia that has one every 3 years. We have real-time data with 2 big surveys that publish within the year of the field work. And of course, one of them reports 12 times a year, every month, the Smoking Toolkit survey. Things have moved on since the 2015 report. We did indeed attract a lot of flack and indeed a lot of libel. Our solicitors were fairly active in having all sorts of false allegations about PHE removed from websites, including the Canadian Broadcasting Corporation. And of course, the Observer, our oldest national newspaper, which claimed that the tobacco industry had paid for our report. By the time of the 2018 report, the most recent report came in, I think we got a much more sober response. It's not that the content was any different or the authors were any different, the same authors saying much the same thing, but the rest of the world had caught up. And suddenly, the things we were saying weren't so shocking. And it's not perhaps surprising. We did have a bit of a head start with this. It wasn't that Martin Dockrell turned up at Public Health England and suddenly madness took hold. We had at least 10 years of work on tobacco harm reduction. This is just the work that's been done by civil society. The Royal College of Physicians did a report in 2007. 100 organisations signed up to the ASH report, Beyond Smoking Kills, which was a comprehensive plan for tobacco control, and that included a chapter on tobacco harm reduction in 2008. Right? 2013, NICE, National Institute of Clinical Excellence, produced its harm reduction guidelines. Oh, look, and of course, one thing you said about that, change your slide about NICE, because your slide is not accurate. NICE do not agree with Public Health, disagree with Public Health England. NICE have explicitly said they agree with Public Health England. Smoking Still Kills was the sequel report to Beyond Smoking Kills that had 150 organisations signing up to it, and the Royal College of Physicians in 2016 do another report. Very proud to have contributed to that report, and it's an update and even more robust. So a lot of careful work gone in there. But like I said again and again, we don't have enough evidence yet. So Public Health England has worked with the UK Centre for Tobacco and Alcohol Studies, which is a confederation of all our main tobacco researchers in the UK, and Cancer Research UK. And we've set up the UK e-cigarette research forum. We get together 3 times a year, researchers, policymakers, and advocates, to look at the evidence that's emerging and to look at what those gaps are and stimulate new research. They're really interesting meetings. Anybody can come. If you happen to be in the UK at the time, it would be great. But we also produce 10 times a year a kind of little summary of the latest e-cigarette research. You can just sign up to the Cancer Research UK website and you'll get that critical assessment of research. It is pretty even-handed. I have to say that because I produced a paper that got completely panned by this service, so thanks, boys. No fear or favour. But it's really well worth doing if you want to keep up with a kind of with the research without having to read all the hundreds of papers on e-cigarettes that come out every month. But I've got to say I have a slightly different view on the US. I think the FDA have some very interesting plans. They have not actually implemented many of the regulations that have been implemented in the UK and in Europe. So rather than, they talk a very hard game, but they have yet to implement many of these policies. But they're moving quite well. I think the NASM report that came out earlier this year was a great improvement on the Surgeon General's report. There's a new Surgeon General who's a bit of a harm reductionist, so it'll be interesting to see the next Surgeon General's report. But NASM said, I disagree with quite a lot of what NASM said, but I agree with the bit where they say e-cigarettes are likely to be far less harmful than combustible tobacco cigarettes, although more research is needed. The American Cancer Society has come on board with this, and they say e-cigarettes are, in general, substantially less harmful than smoking cigarettes. And the US annual review of public health has out-PHE'd PHE, and they say a diverse class of alternative nicotine delivery systems are substantially less harmful than cigarettes and, critically, may provide a means to compete with and even replace combusted cigarette use, saving more lives more rapidly than previously possible. That's not from England, that's from the US. And what's happened with smoking and vaping in the UK? Well, I've been involved in tracking vaping behaviour since about 2009. That's the first survey I did with Anne McNeil. And we used to see very high levels of dual use, and we've seen much lower levels of dual use with more smokers switching completely. And that's a good news, good measure. The latest data is in for 2018, and that's continuing. And you can see that there's very, very low levels of e-cigarette use among people who have never smoked. That increase from 2% to 3% is not statistically significant, but what's pretty interesting is that if you ask these people why they're using e-cigarettes, about a third of them say, I was using it to give up smoking. So these are obviously not all people who have never smoked, so there's a little glitch in the data there. But this is kind of interesting. We've also been monitoring use among young people and reporting it faster than any other jurisdiction. And this is, so again, as I said, from the US data, we think it looks like e-cigarette use among young people has at least plateaued and may indeed have peaked, at least in the UK and the US. And that increasing line, that 25%, is among young current smokers. Now, I agree that we don't want any young people to be vaping, but it's really important that you realize that we're talking about young current smokers. And if you want to know what young never smoker, can you see that purple line? That's kind of, well, let me magnify this for you by 300%. Right, now you can see what's going on with young people who have never smoked. This is reported e-cigarette use in the last month, but 0.2%. Our confidence intervals take us below zero for that. I mean, young people who don't smoke hardly ever vape. Now, we had a reference to one of the US, the Primac study earlier on today, which is one of the US gateway theories. And the gateway ideology theories, they tend to ignore, they're really interested in what happens among young people who have never smoked, so they look at their vaping behavior. So they look at this 0.2%. And they ignore all the young people who have already smoked, which is where all the vapors are, right? So they ignore 98% or more of the vaping. And if you're only interested in never smokers, then that makes sense. But if you care about smokers, then you're only looking at a tiny fraction of the picture. And to illustrate this with the Primac study, they eliminated, the vast majority, all the kids who'd already smoked, right? That's all the kids who vaped, pretty much. And they were left with about 960 smokers from memory. 960 young people who had never smoked. Of those, they looked at those who had vaped. They found 18 had vaped at least once. So they followed them up to time 2, and they found that 6 of those, 1 in 3, went on to smoke. So that was much higher, that 1 in 3 rate. But it accounted for less than 10% of new young smokers. So it's not even featuring as a big part of youth uptake. And so there's a real danger in thinking that these studies tell us much about youth vaping. They tell us quite a lot about young people who don't vape and young people who don't smoke. But if you're concerned with smokers and vapors, you're looking at through the wrong end of the telescope. So what else do we know about these young people? Well, I've stacked the data slightly differently here. You can see that those who have never smoked, 95% of them have never even tried vaping, 4.5% of them have experimented, and less than 0.5% monthly or more use. Then I'm going to overrun, I'm afraid. Then former smokers, similarly, much lower level, and the most use is among current smokers. It's by far the most popular quitting tool, as we've heard. And this is what happened. We heard also about the recent New England Journal study. And this data is very different. So this looks at real clinical practice from e-cigarettes, from stop smoking services. And if you combine behavioral support with stop smoking services, you see very high rates of success. And so 2/3, which is actually about substantially higher than nicotine replacement therapy, and even higher than varenicline. So we have been, as you know, doing campaigns, our Stoptober campaign, which has for the first time included vaping, and that has involved partnering with the non-tobacco e-cigarette manufacturers and retailers. And it resulted in an increase of e-cigarette sales by 29%. That's not a bad thing in my view. We're also doing the education for professionals, NCSCT, for example, online training, advice to health professionals in the NHS on what they can tell people about e-cigarettes. On our websites, similarly. And we've also produced a range of videos. On the left, you see the expert video with various UK researchers. On the right, you see the other experts. This is vapers talking to vapers, very useful. We've also done a couple of cartoons. I might put them up during the coffee break. I'm going to skip these. If they're interesting, call me back next year and I'll present them. But the really worrying thing is this. It's not all rosy in the UK. We're seeing an increasing mistaken perception that e-cigarettes are at least as harmful as smoking. It's a mistaken perception, right? And this really, really matters. So you see the bunch of people who agree with RCP and PHE, and presumably everybody educated in this room, and the NASM and American Cancer Society, that number has been shrinking, but the number of people who believe, and smokers who believe that e-cigarettes are at least as harmful as smoking has been increasing. And this is a real problem because it's a deadly misperception. Smokers who believe that e-cigarettes are at least as harmful have no reason to switch. Right? And they don't. They're much less likely to try smoking, and they're much less likely to try vaping, and if they do try vaping, they are way, way more less likely to switch completely. So they're much more likely for dual use. If you want to scare smokers into smoking, scare them out of vaping. Okay, so very quickly then my conclusions. UK already has some of the toughest e-cigarette regulations in the world. We have a long history of tobacco harm reduction too. And we combine these with the regulations from the Tobacco Products Directive to make sure that all products are tested by our medicines regulator, MHRA, who are also responsible for regulating electronic cigarettes. There's little risk of harm from passive exposure. I spared you those slides. E-cigarettes are helping smokers to quit in England, but it's really important that we continue to monitor the evidence as it emerges and change our policies if we're having unintended consequences. Thank you.